Dear friends and colleagues, today I'm going to share with you again one of my cases. I'm going to use in this case sinus lifting and ridge expansion in the premolar and molar area of the upper maxilla. We'll do ridge expansion at the tooth number 24 and sinus lifting at the tooth number 26. As we see here, the X-ray, there is narrow bone at the premolar area, and at the sinus area at the tooth number 26, the height of the bone is around 5 millimeters. As you see here, it is not enough for implant placement. The plan is to put two implants with the height of 10 millimeter implant at both sides. We start with incision as usual. I'm trying not to make any vertical incision at the anterior region to maintain the bone around the first premolar, not to have any gingival recession, and to maintain the interdental papilla between the tooth number 1-4 and the implant. We start our osteotomy as usual with the guiding drill. Then we start with the initial drill with the full length at the premolar region. Then we go to the molar area, and as we measure the diameter or the length, it was 4.8. We go for 4.8 or 5 millimeter. Then we start with 5 millimeter diamond burr for the elevation of the floor of the sinus. Here we shifted to 6 millimeter because there was here some resistance of the bone. It is not fully approaching the sinus because the floor of the sinus is not flat. Sometimes you reach from one side, but from the palatal side it's still not reached, so you have carefully to probe this area. Then we go for expansion at the premolar region until the corresponding diameter of the implant. We can use only the handpiece or the ratchet, but we have to still with the expansion to follow the line of insertion of the implant and to keep parallel to the adjacent tooth or root. And this is the final expansion drill. Then we cut a piece of gel foam. I prefer to use gel foam at the base of the sinus so that it acts as a barrier between the bone graft granules and the Schneider membrane on the floor of the sinus. As during condensation of the bone graft, the sharp area of the bone graft granules may injure the sinus floor. So I prefer the bone graft section by the gel foam. We condense the gel foam in place, then we start applying the bone graft using a suitable size bone graft carrier. And start condensation using the condensation or the condenser stopper, so that we do not over push the bone granules against the floor of the sinus. This is the diameter of the implant we had selected. Then we start insertion of the implant, either with the handpiece or both the handpiece and the ratchet. It is very important at the site of the ridge expansion to check the integrity of the implant and its initial stability, because usually there is worry about overexpansion of the bone. We can see here that we reached the maximum torque of insertion. It's 45 Newton or 50 Newton. Look here, it is 50 Newton. Then we cover the implant with the cover screw and suture. Thank you, my friends, for watching my video, and please, if you have any question, you can leave it.